Ladies and gentlemen, I invite you to please give your attention to former Governor of South Carolina and U.S. Secretary of Education, Dick Riley.
Thank you. Thank you so much, Jill, and it's good evening to all of you. It's certainly a great pleasure having you here. It's a great crowd, and we're going to have a very interesting evening. My job really is to introduce our new president, Elizabeth Davis, be Furman's 12th, and that'll be my pleasure. Before I do that, I'd like to recognize the members of the General Assembly who are here, both of whom are my friends that I respect a whole lot. Representative Gilda Cobb-Hunter and Kenny Bingham. You'll hear from them later on in the evening. Kenny's twin daughters just graduated from Furman, and I know you're proud of that, and they're going on to medical school, I understand. And Gilda, it's great to have you here as always. I then will take pleasure in presenting our president, Elizabeth Davis. Elizabeth is a graduate of Baylor University. She received her PhD then from Duke. She comes to Furman from Baylor, where she was executive vice president and provost. And those of you know Baylor, of course, it has a similar culture and background to Furman. It's much bigger, but that will be an interesting transition, I know, for you, Elizabeth. There at Baylor, she oversaw 11 schools and colleges, as well as more than a dozen research centers and institutes. President Davis now has served Furman as president for 3 weeks and 1 day. So she is relatively new. However, she's been in Greenville a number of times to get to know the people and to get a feel for Furman, and met with a lot of people, including faculty, of course, board members, alumni, students, and what have you. And she also was getting ready for her daughter Claire, who's going to be a senior in high school this year, to be located here in Greenville. Her husband, Charles, is here, and Charles, it's great to have you with us. In addition to all that, she's been participating in all of the Furman activities up to this point and even beforehand. And President Davis, we're so honored to have you as our president. We look forward to a lot of years working closely with you to, as you said, raise a bright future for Furman. I think we do have a bright future, and we'll have it with your great leadership. And now it's a pleasure to present Elizabeth Davis to you, and please join me in welcoming her.
Well, thank you, Secretary Riley. Good evening. Welcome to Furman University and to Can't Win for Losing, the Crisis of the Working Poor, a straight talk series presented by the Osher Lifelong Institute, better known to many of you as OLLI at Furman, and the Riley Institute at Furman. OLLI at Furman is directed by Nancy Kennedy. Nancy? Yes, good. And the Riley Institute is directed by Don Gordon. Thanks to both of you. The partnership between these institutions has led to this very popular and highly regarded annual series that looks at critical issues facing the state of South Carolina. As one of South Carolina's newest residents, I'm interested in learning more about the challenges and opportunities that face our state, and I'm delighted to see all of you here who share that same interest. We're in for a stimulating evening as we will hear perspectives from both sides of this aisle of the South Carolina legislature. And in particular, I'm looking forward to playing the role of student this evening as we hear from Dr. Jessica Hennessy, one of Furman's greatly admired professors of economics. As Secretary Riley mentioned, I've been serving as president of Furman for 3 weeks. Yet in this short period of time, we've grown to love Furman and Greenville, the people, the hospitality, and the opportunity really to enjoy cultural events like this evening's Straight Talk. Charles and I, we both jumped into this new adventure with both feet. Claire as well. We gave Claire the option to stay in Waco or move, and after visiting Greenville, she chose to move. Today is our 25th wedding anniversary. And we're just delighted to be able to share the evening with you. No, we really are. I mean, it's 25. It's not like it was the third one or something. At this time, I'd like to welcome to the podium Mark Quinn, who is a familiar face to many of you and who will serve as the moderator for our 4-week series. Mark cares deeply about South Carolina and particularly about the complex issue of poverty in our state. Moreover, he's skilled at getting to the heart of an issue as well as engaging diverse perspectives on causes of and potential solutions to complex problems. Mark is the former host of SCE TV's current news and events show, Big Picture, and currently works as Director of Public and Member Relations for the Electric Cooperatives of South Carolina. Won't you join me in welcoming Mark Quinn?
Thank you so much, President Davis. I know you will love it here at Furman University. This is a great, wonderful institution. Ollie and the Riley Institute, tremendous aspects and tremendous components of Furman University. And Secretary Riley, as always, great privilege to be in your company, a great privilege to work with you on a regular basis. Thank you so much for your support and mentorship. As they mentioned, we are going to be talking about the working poor and the crisis of the working poor here in South Carolina. There was a new stat here just today, not about the working poor, but about the number of children who are being raised in poverty. I don't know if anybody saw that headline, but 28%, more than a quarter, more than 1 in 4 of our young people in this state today are being raised in conditions of poverty. And one of the things that we know about poverty is that if you're raised in poverty, you're brought up in poverty, you're most likely to continue living in those impoverished conditions. So we're going to get to that here in just a minute. And of course, we're going to have Jessica highlight some of the faces of the working poor, who they are, what they do, how much they make, how much they don't make, what classifies the working poor, and what do you need to really make it in society today. One of the things we want to do, housekeeping-wise, before we begin, please, anybody who has a cell phone, turn off your cell phone so there are no interruptions. You may have seen some of the quotes that were scrolling up on the screen before we started here today. Some of them were rather incendiary, some of them were rather inflammatory, and that was designed on purpose to get you thinking. Because as we think about poverty, and as we talk about poverty, we can agree on how many people fit that notion, how many people fit that bill, but we have really stark and partisan disagreements about what to do to fix that problem. Is there enough government assistance? Is there too much government assistance? Are we doing too much to help in creating this culture of dependency? Or are we ripping out what used to be a social safety net, giving people a chance to get a leg up in our society? These are things that we argue about quite a bit at both the state level and the national level. Coming up in a little bit, we will hear from 2 state representatives who may have different opinions on how we arrive at these conclusions and how do we improve our state from this perspective, but you can't question their loyalty and dedication to the state of South Carolina. Representative Kenny Biggin and Representative Gilda Cobb-Hunter will be here to talk about some of these conversations we have at the State House year in and year out. But first, let me introduce Dr. Jessica Hennessy, University of Maryland College Park graduate. She joined Furman economics faculty in the fall of 2009. Her research focuses on causes and consequences of institutional change within a fiscal federalism framework. Her teaching interests include public finance, economic history, microeconomics, and econometrics. She's a talented and dedicated advisor. Professor Hennessy is a deserving recipient of the Alistair Furman Jr. and Janie Earl Furman Award of Meritorious Advising, and she has been a co-advisor of the Furman Economic Society. Please join me in welcoming Dr. Hennessy.
Well, thank you to Ollie and the Riley Institute for having me here today. I'm really excited to be a part of this series. If you've taken a look at the schedule over the coming weeks, you know that we've got some really interesting speakers to look forward to, and they're going to give their own personal stories and perspectives on issues important to the working poor. My role here today is to kind of zoom out from that individual level and to give some data, statistics, and information just kind of on the general issues associated with the topic of the working poor. As Mark said, I'm a public finance economist. That field is interested in the intersection of the government and the economy, specifically looking at different tax and spending policies. Some of those policies are designed to help the poor, and particularly the working poor, and I'll touch on a few of those federal policies later on in my talk. I hope the presentation today merely opens the door as we continue to explore these topics together over the coming month. Okay, so I've got a lot of slides. We're running short on time already, so I may fly through some of these as we go along. But just to get us started, let's start with a formal definition of what the government talks about when they kind of measure the working poor. So the formal definition of poverty has to deal with the federal poverty line. When you just look at what the federal poverty line, and abbreviated on all my slides is FPL, so that's federal poverty line. Of the population, 15% fall below the federal poverty line. Okay, so that's just poverty. If we talk specifically about the working poor, we need some definition of what it means to be working. Well, the way the government, the way the census calculates who's working, they say, well, who's in the labor force? Who's either employed or who's either unemployed and actively looking for a job? When we consider those that are actively working or actively looking for a job, then we have 10.6 million in the US that are considered working poor. Okay, those are national level statistics. We'll delve into kind of the South Carolina and Greenville statistics later on, but that's just kind of the broad overview. This is a very basic definition and really kind of inflexible, right? There's a lot of people, one of the issues with the working poor that's important to keep in mind is that individuals often transition in and out of this, right? So we may want to talk about the episodically poor. Okay, this is another formal definition. Okay. And what it is you're below the poverty line for 2 consecutive months over the course of 3 years. Okay. When you look at the episodically poor, that's a third of the population of the US. Okay, so these are individuals that are, having to deal with these issues of financial insecurity, these stressful issues, the uncertainty involved, and the risk involved in terms of not having a job. If we even talk about a broader definition, so there's been a lot of work in the economics field that talks about lower middle class. And kind of a generally accepted measure for lower middle class is up to 250% of the federal poverty line. When you look at those numbers, that's almost 50% of the population. Okay? So this is just giving you kind of, again, that broad overview of the scope that we're talking about here. Now, if you're like any of my students, you might say, okay, there's all this stuff about the poverty line. What is it, right? What is the number? Okay, here are the numbers for the 2014 federal poverty line. It's pretty simple how it works. It goes by the number of people in your household. So if you're one individual, the poverty line for you is $11,670. So if your income before taxes is $11,670 or less, you're considered below the federal poverty line. The number that you'll hear about a lot in the press is for a family of 4. So that may be a good reference point for you for the rest of the talk today. So for a family of 4, if you think 2 parents and 2 kids, that's $23,850. Okay, that's probably the most common statistic you'll hear reported. Okay, now your next question should be, well, how did they come up with it, right? Where is this $23,850 coming from? So there's a really, I think, interesting story about where the federal poverty line comes from. It started in 1963 by one economist, Molly Orshansky, at the Social Security Administration. Okay? So she was actually tasked with writing a report on poverty as it affects children. So she was setting out to kind of analyze this data on poverty and how it affects kids. And she said, well, there's no official poverty guideline. So I need to establish one in order to create this report. So what she did was she looked back to some previous research she had done about the elderly and minimum incomes necessary for elderly in retirement. And what she had done in 1960 was she had taken a survey of households from 1955. And in that survey, it said that families typically spend about 1/3 of their income on food. Okay? And so she said, well, then the minimum income for individuals will be 3 times what they spend on food. Okay, that's how she came up with the poverty line. Okay, well, how did she get how much they spend on food? She looked at the Department of Agriculture's, they had 4 nutrition plans, and she took the lowest cost one of that. The lowest cost nutrition plan was designed for temporary or emergency use when funds are extremely low. She took that amount, multiplied it by 3, that's the poverty line. Hasn't been changed since then. The only thing that's been changed is that it's been updated each year to account for the CPI inflation. Okay? Nothing has changed. In 1969, those poverty guidelines were the U.S. Bureau of the Budget, which is now more commonly known as OMB, the Office of Management and Budget, designated the poverty threshold as the federal government's official statistical definition of poverty. Okay? And it's been that way ever since. Now, hopefully you can kind of see maybe some of the problems with this, right? There's no cost of living difference. So that same $23,850 in Greenville is the poverty line here, and that's also the poverty line in San Francisco and New York City. Okay? Another problem with this is that it uses income before taxes and transfers. Okay? So it's your income that you receive before you pay any taxes to the government or before you receive any transfers. So a big problem with the poverty line is when you look at the effectiveness of programs and you see, oh, well, did welfare help bring people above the poverty line? They have the same income before and after because you're not capturing the welfare that they're receiving. So it looks like the poverty line often remains unchanged when you look at the effectiveness of poverty because you're not capturing those effects in the measure. So some kind of big problems with the poverty line. So despite all the problems and despite its humble beginnings, it's used a lot in government, right? It's used by 82 federal programs to either administrate funds, okay? So Medicaid, as we'll talk about, administrates funds based on the poverty line. It also determines eligibility, okay? So with all the problems involved, it's really an important statistic that's used. And maybe politically, we can talk about later, but politically it's a very hard thing to change. And the reason why is if you change the poverty line and poverty measures go up, people might say, well, you've been hiding poverty all this time. And if you change the poverty line and you come up with fewer people in poverty, people have been saying you've been overstating poverty all these years. So no matter kind of what side you're on, there's not a huge incentive to change it because of maybe some of the political risks involved. Okay, now that we know about the federal poverty line, let's look at some data, which as an economist, I love to do. Okay. So the data I'm looking at is from the American Community Survey that's done by the Census Bureau. And for those that remember the long form of the census, it was given to every 1 in 10 individuals. That was done away with in 2010. There's no more long form. In replace of that, they're doing the American Community Survey, which they do every month, and they survey 250,000 households. Okay? So the data you're going to be looking at is over a 5-year span from 2008 to 2010, and I'm using that because I'm getting the biggest sample I can, so that's the most reliable data, and I'm going to be able to kind of zoom in on census tract level data as a result of this. Okay, so what we've got here, map of the US, and the data that's represented here is the percent of the population below the federal poverty line. Okay, so we're not looking at the working poor, it's just everyone below the poverty line. The range here, if you can see over on the right-hand side, the lightest color, so the lightest shade of green says 8.4%, and the darkest green is 22.3%. Okay? You see the state that kind of stands out as the darkest? Mississippi. Okay. The other really low state is New Mexico at 19.5%. South Carolina, pretty dark color. South Carolina is at 17.6%. It's the 8th highest state. We are tied with West Virginia. Okay, so that's where South Carolina falls. The national average here, do you remember from the first slide what the national average is below the poverty line? 15%, okay, so South Carolina is above the national average. On the low end, we've got states like New Hampshire at 8.4%, Maryland at 9.4%. So it's a lot of the New England and East Coast states that are on the low end. Okay, so keep in mind, what's the national range here? 8.4 to 22.3. Now I'm going to zoom in on South Carolina. Okay. Here's the state of South Carolina. This is county level data. Okay. Now the county level data range, I know you can't read it, but I'll tell you it's 11.4 to 36.3. Okay, so the county range, the average county in South Carolina, the range is bigger than what the national range is. Okay, so this is why it's important now to start looking at more detailed level data because we get a lot more variation. You can see the two kind of greenest counties here In the southwest, we've got Allendale County at 36.3%. Remember what this means. 36.3% of the population is falling below the poverty line. The other highest county is Dillon, up in the northeast. They're at 32.8%. Okay. The lowest counties are Dorchester and Beaufort, 11.4 and 11.6%. Okay. I knew we had 2 representatives here, so I got their information. I won't quiz you on what it is. But Representative Bingham's from Lexington County, and Lexington County is at 12.4%. And Representative Gilda Cobb-Hunter is from Orangeburg County, and that's at 24.5%. Okay, so just the 2 of them sitting next to each other, it's almost double. Okay, so we're talking about significant differences here within and across the counties here in South Carolina. Okay, so let's get within a county. Now I looked just at the upstate. Can you kind of tell that that's a map of the upstate? Okay. So the middle kind of rose-looking thing is Greenville City. Okay. And then we've got Spartanburg up in the upper right-hand side. Okay. And again, it's shaded here according to the intensity of people living below the poverty line. So the range here, if I'm not blocking it over on the right-hand side, goes from 0.3%. So some county, this is census tract data, so very small geographic areas. The smallest is 0.3%, all the way up to 64.6%. Okay? Some census tracts in our area, 64.6% of the population is falling below the poverty line. Okay? I wanted to highlight some of these census tracts, and so I isolated them. And so now you can even see streets on here. Okay? So we've got, if you see it's on the top of the graph, that line, it even says Poinsett Highway. So you probably drove on that coming here to Furman today. So these are just the census tracts in Greenville County that have greater than 40% of the population living below the poverty line. Okay? And the 2 colors, the lighter color are those in 40%, the very dark green are over 50%. Okay? So that West Greenville tract, it's right off Pendleton Street in West Greenville, 61.6% of individuals in that census tract live below the poverty line. Okay, the one up there near Cherrydale, Poinsett and Pleasantburg, that's 56.5%. Okay, so over half live below the poverty line there. So I just kind of want to give you some context for the population that's in our community. Okay, so all of this was talking about all individuals living below the poverty line. I want to focus on one type of statistic that will focus in on those working. Okay. So the data I'm talking about here is of those people in the labor force, okay, so of those people that are either employed or unemployed, what percent are falling below the poverty line? So of those that are actively employed or are actively looking for work, what percent fall below the poverty line? It's a smaller percentage here at the state level, 4.8 to 13.1, and you can kind of see the same patterns, right? Mississippi and New Mexico stand out. The East Coast is relatively lighter. Unfortunately, South Carolina here rises in the rankings. We're 4th now. We're at 11.1%. Okay. Looking at South Carolina, again, we see the same patterns. The same counties stand out as having extremely high percentage of the labor force below the poverty line. On the high end, again, is Allendale at 25.5%. So a quarter of the people in the labor force, those that are working or actively looking for work, are below the poverty line. On the low end are Dorchester and Beaufort counties, and again, now Lexington joins them. Lexington is at 7.4%. Again, zooming in on Greenville, we see even greater variation, right? When you dial in, you see even wider variation. Now, our census tracts go from 0 to 51.4%. So that dark tract that we were looking at before in West Greenville, of those in the labor force, 51.4% are below the poverty line. Of those employed or actively looking for work, over half are below the poverty line. Okay? So what all of this geography has told us is that there's a lot of variation across space, right? And looking at national level statistics, looking at state level statistics obscures a lot of that detail, right? And so looking at this fine level of detail at the census tract is really giving us a better picture of the heterogeneity, right? The variety that's going on in our community. Okay, so now that we've kind of thought a bit about kind of the magnitude of things, I want to talk about the population below the federal poverty line, right? So now I want to talk about kind of the variation in terms of demographics, right? Who is it below the poverty line, and what are some interesting characteristics that we can talk about? Okay, so I'm going to explain what's going on here because some other charts after this follow the same format. Okay, the leftmost column is the United States, the middle column is South Carolina, and the rightmost column is Greenville County. Okay, so we've got national, state, county. Okay, what this data is showing is of the population below the poverty line, what are their ages? So without looking at the numbers, the first thing you should see is, well, the US looks really similar to South Carolina, and South Carolina looks really similar to Greenville, right? So the patterns seem to be relatively the same. Okay. What the different categories are, the purple represents kids, so it's individuals under the age of 18. The blue bar at the top are those over the age of 65, and so that middle bar is 18 to 64. So what we've got here is, of those below the poverty line, about a third of them are kids. Of those below the poverty line, about 8% are over the age of 65, and then the remainder, 50 to 60% are kind of working age individuals. So when we talk about the working poor, we're talking about those people in that kind of turquoise category, right? There are some people over the age of 65 that work, but for the most part, those are retired individuals, and we're assuming that kids, especially those under the age of 16, are not working. Okay, here's the breakdown by education. Education was brought up earlier as an important thing that will be talked about later. So this is the population below the poverty line, again for the US, South Carolina, and then Greenville County. And our four categories, the purple is less than a high school degree. The turquoise is just a high school degree. The blue is some college, and then the red at the top is a bachelor's degree or higher. So here's where education plays a really important part, right? And especially as Mark was saying earlier about transitioning out of poverty, right? So of those below the poverty line, 2/3 have a high school degree or less. Okay? And if we look at just Greenville County, for example, of those below the poverty line, 7.7% have a bachelor's degree. On average in South Carolina, about a quarter of people have a bachelor's degree or higher. So there's a significant advantage to having at least some college in helping you get above that poverty line. Okay, this next one is race. Okay, now you should see some differences between the US, South Carolina, and Greenville County. Okay, so this is of those below the poverty line, what percent are categorized as white by the census, Black or African American, and then the other categories, American Indian, Asian, Native Hawaiian, other race, or two or more races. So the two biggest categories you'll see here, the purple is white, and then that turquoise, the second color, is the Black or African American. Okay? So of those below the poverty line in the US, about 60% are white, 21% are Black or African American. That percentage of Black or African American grows when you look at South Carolina, Greenville. That's actually not too surprising because we have almost, as a fraction of our population, we have almost double the national average in terms of that category. But these do shed some light on who the population in South Carolina is that is below the poverty line. Okay, now we're getting into some information on work. Okay, so this is the population below the poverty line. Now we're breaking it down by employment. Okay, the purple here hopefully isn't working. These are the kids, the population under the age of 16. That turquoise color are those that are working full-time. The blue, those that are working part-time. Okay, that's an important thing to notice, is that difference between that small bar are those that have full-time employment, the blue bar are those that have part-time employment. The red are those that aren't working. They're not in the labor force. Okay? So this is going to bring up another issue. One of the things that is significantly impacting people and causing them to be below the poverty line is this issue of part-time work, this inability to find full-time work even when they're looking for it. Okay, so of those that are working here, the two blue bars, where are they working? So here's some industry level data that I pulled, okay? So these are so what each bar represents is of those people employed in this industry, what percent fall below the federal poverty line? Okay. So the highest industry here is farming, fishing, and forestry. Of those people working in that industry, 15% fall below the poverty line. The next highest, service. Probably not surprising, right? Of those working in the service industry, 14.1% are falling below the poverty line. Then we've got, for those that can't read, we've got, or can't see the text, sorry. That can't see the text, we've got construction, transportation, sales, production, and then the bottom three, office and administrative support, installation, maintenance, and repair, and the lowest category, management and professional. Okay, so this gives you a glimpse of those industries that are highly affected here. Okay, so these are some interesting statistics. This was from a BLS report, so BLS stands for Bureau of Labor Statistics. This comes from their 2012 report on the working poor. So they looked at this micro level data, this individual level data, and determined that of those working poor, we can kind of separate them into different cases. Okay? So 84% of the cases they grouped, okay, and they identified them as being working and being pushed below the poverty line for these three reasons: low earnings, periods of unemployment, or involuntary part-time employment. What that last category means is they were looking for full-time work and either couldn't find it or were pushed into part-time work because of slack business conditions. Okay, so they're looking for work, they want full-time work, they can't find it. The other 16% of the cases of the working poor are due to short-term employment, voluntary part-time employment, or a family structure that increases their risk of poverty. So when we're talking about government policies that are designed to help this group of the working poor, we want to maybe think about those three predominant reasons, right? We want to think about the low earnings, we want to think about those periods of unemployment, and we want to think about those slack business conditions that don't allow people to find full-time employment that they're looking for. Okay, so now we get into kind of my wheelhouse, which is public finance issues, the role of government programs. Okay. I want to point you first to this report, this paper published by Melissa Carney called Policies to Address Poverty in America. It was just published this year. It was published by the Hamilton Project, which is the economic policy initiative of the Brookings Institution, a think tank you guys may have heard about. They found that twice as many Americans would be impoverished if not for public safety net programs. Now they're taking all safety net programs here into account, from SNAP, which is Supplemental Nutritional Assistance Program, to TANF, which is Temporary Assistance for Needy Families, the welfare program, unemployment insurance, Medicaid. They're taking all of those. Out of all of those programs combined, twice as many would be impoverished if not for those programs. What they point out is that addressing issues of poverty and public policy's roles in that kind of needs to have a multidimensional nature, okay? And if you look at their kind of four overarching categories, you kind of see the progression over a person's life, right? One important thing is promoting early childhood development. So this is where preschool maybe has a role. Supporting disadvantaged youth, education is important here. Building skills, making sure that individuals that are looking for work have the right skills and are able to match to the jobs that are available. And finally, improving safety net and work support. And that last one is kind of the last resort, the immediate intervention, and that's the one I'll be talking about most going forward. So I think this is really interesting, so I threw this in, but it's a little hard to see the point initially. Okay, so we've got two colors going on here. Okay, we've got light green and we've got purple. What we've got on the x-axis is family income. Okay. What each bar represents is the percent of families earning that income. Okay. The green bar represents the pre-tax, pre-transfer income. So it's just kind of what they're earning before the government gets involved, before taxes are taken, before any transfers, any welfare payments are made. The purple line represents the post-tax, post-transfer income. So it's after taxes are taken and after benefits from different governmental programs are paid. What you can see is that public policies have kind of shifted that income distribution, right? So if you look at kind of I think the best way to look at it is the second and third column. So for those earning from 1 to 20,000, initially there were 15% of families there. That has now decreased after taxes and transfers from the government, mostly transfers here, right, that has decreased to 12% and has shifted some of those people into the higher income category. Okay? So the point here is to recognize that the current U.S. tax and transfer program, current government programs do have an effect on shifting the income distribution, right? It is having an effect on kind of bringing some individuals at least above the poverty line. To kind of focus in on a specific case, okay, again, this is coming from the report that I mentioned earlier from the Hamilton Project. This is looking at what is the experience of a particular family, okay? What might they experience in terms of government programs? So we're looking at a single parent with 2 children living in Colorado in 2008. Okay? All of those are really important because income, family size, location, all have an effect on the benefits you receive. Okay? So we're looking at single parent, 2 kids, Colorado. What you can see is initially, on the x-axis here is household earnings. Okay, on the horizontal axis is household earnings, and on the vertical axis is the amount of benefits they'll receive from the government. So if this single parent with 2 kids has 0 earnings, what you'll see is that 2 programs come into play. Okay? The 2 programs that come into play are SNAP, that's the purple section. Remember, SNAPs is the food stamps, okay, formerly the Supplemental Nutritional Assistance Program. And the other program that comes into play for that family with 0 income is Medicaid. Okay? Medicaid, the government program, health insurance for low-income families and kids. Once this individual starts earning income, then you can see the interplay of other government programs. One that I'll talk about is EITC, the Earned Income Tax Credit. As soon as you start earning that first dollar of income, that's when that Earned Income Tax Credit will start to kick in. Other government programs on here, you see our CHIP, that's Child Health Insurance Program. That transitions in when Medicaid transitions out. You'll also see the Child Independent Care Credit and the Child Tax Credit. The important distinction between the Earned Income Tax Credit and those 2 tax credits, the Earned Income Tax Credit is refundable. So even if you don't owe any taxes because you have extremely low income, you're still eligible for the Earned Income Tax Credit, where you may not be for the Child Independent Care Credit. Okay, so 2 programs I'm going to speak on in more detail are on this graph. I'm going to talk about the Earned Income Tax Credit, and I'm going to talk about Medicaid. Okay, but I wanted to show you here the interplay of these and how they change based on what income level you have. Okay, so the Earned Income Tax Credit, for those that aren't familiar with it, was enacted in 1975. As I mentioned, it's a refundable tax credit, and it's been very politically popular over the years. And it's politically popular, 1, because it decreases poverty by increasing income. At the same time, it's encouraging work and reducing welfare costs. Okay, so you've got good things on both sides here. Okay, this is a graph I present to my students, a chart I present to my students to talk about how the Earned Income Tax Credit is designed, because it's got a very unique design in terms of federal programs. What I've got here on the horizontal axis is earned income, and then again on the vertical axis is the value of the credit. Okay. So as you can see, as you start earning income, your credit goes up. At a certain point, you reach a maximum, and then as you start to earn more income, that credit decreases. Okay. And what this is doing is it's giving people an incentive to start working. And as you start working, you get a larger and larger credit. Okay. The maximum here, if I take, I should say here, the trapezoids, the different colored trapezoids here, are representing different family sizes. So the smallest trapezoid is no children. Okay. The purple one is 1 child, then we've got 2 children and 3 children. The difference between the solid and the dashed is whether you're single or married. Okay, the married is extended a bit further. So if I take the family with 2 children, the maximum earned income tax credit that you could earn in 2014 was $5,460. Think about that magnitude for a second, right? And for the income that those people are earning. So you might, as a family of 3, single with 2 kids, be earning around $20,000 and be getting an earned income tax credit of $5,460. Okay? So this can have a significant effect on lifting people above the official poverty line or above those relative poverty measures as well. Okay. I should say the average earned income tax credit is about $2,200, just to give you a sense of things. To look a little about how the program has changed over time, I want to emphasize how much this has grown since it started in 1975. And this is due in large part to its politically popular nature. Okay? The green line here is our traditional welfare programs, which started off being called Aid for Families with Dependent Children, or AFDC. Since 1996 welfare reform, it's called TANF, Temporary Aid for Needy Families. That's pretty much remained constant over time. And what's really taken off, that blue line, is the earned income tax credit, as well as the child tax credit. Okay. The earned income tax credit was expanded under Reagan, under Tax Reform Act of 1986. It was expanded under Clinton 2 times in 1990 and 1993, and it was expanded again under the Bush tax cuts in 2001. Okay? So no matter the administration, there's always been this incentive to expand it because of the measured effectiveness of the program. If you look at the value amounts here, so the earned income tax credit, I think I've got fiscal year 2011 on here, is over $60 billion. Okay? How that compares to other programs, SNAP, the food stamps program, is about $78 billion. So it's right up there in terms of significance of the budget involved of this tax credit. Okay. So to getting at some of the effects, here's where the economic research comes in. Okay. So we've got this EITC, we've designed it. Has it had any effect? Well, if we look at the income effect, it's been estimated that it's kept about 6.5 million, including 3.3 million children, out of poverty in 2011. Okay. So again, we're thinking about, well, how many are in poverty? It was about 45 million. So not a huge amount, but a significant amount, right? 6.5 million. Okay. What I'm not going to talk about here are the income effects that you have to raise taxes in order to pay for the earned income tax credit. So there are negative income effects here, but that's a whole other series, right? But we're just talking about the positive income effects here. But obviously there are going to be other unintended effects that come about by raising taxes to pay for this. The labor supply effects are really interesting here for the earned income tax credit. And they're interesting because theory predicts opposite things might happen. Okay? So think back to how that earned income tax credit is designed. As you start working, you get an automatic bonus. What we would call that in economics is an income effect. You get this flood of cash in. You might say, oh, I've got this bonus. I might want to work less, right? So it may have a negative labor supply effect. At the same time, you may say, for each hour that I work, I get a higher credit, right? What might that do? It may incentivize you to work more. Okay, so economic theory in terms of the income and substitution effects predict opposite things might happen. So you've got to go to the data and look at it and do research. And what we find is that labor force participation is affected a lot. You get a huge bump, especially for single mothers. With the introduction of the earned income tax credit, labor force participation of single mothers increases a lot. Okay? You actually get them to enter the labor force. There's a slight decrease for married women, so that kind of counteracts that increase for single mothers. You get a decrease for married women because the way it's designed, there's actually a marriage penalty involved. So there's a penalty in terms of getting the credit if you're married. In terms of the evidence for hours of work, we don't really see any labor supply effect. So the earned income tax credit doesn't seem to do very well if we're trying to just get people to work more that are already working. Other effects that people have found, it improves child test scores, it reduces low birth weight births, and it improves health indicators for mothers. Okay? So because you have more that you can spend out of pocket, all of these other things come about as positive results, right? So these are the long-term effects that this program may have on fighting poverty. Okay. Something that you may not realize, states have earned income tax credits as well. Okay? So they build off, they're usually a fraction of the federal, but 26 states in the US have state earned income tax credits as well. South Carolina is not one of them, so you may not be familiar with the program as a result of that. But these states that are highlighted in either blue or orange do have state earned income tax credits. Okay. The next program I want to touch on briefly is Medicaid. Okay. Medicaid helps 66 million people. About 50% are kids, 9% are elderly, 18% disabled, and then 23% are adults. So the population most helped by Medicaid, at least right now, are kids. Okay, the Medicaid program is federally mandated, but it's administered by the states. So in South Carolina, our Medicaid program is called Healthy Connections. Okay? It's financed on a shared basis out of general revenues, and it's really interesting the way it works. Okay? So the federal government shares in the spending on Medicaid, and it shares based on a state's income. So the lower your state's income, the more the federal government contributes. The higher the state's income, the less the federal government contributes. Okay, it's this, the federal Medicaid multiplier is what it's called. And I just wanted to show you the variety here. On the low end, it's $1 for $1. So in states like Massachusetts and Connecticut, that state spends $1, the federal government chips in $1. You can see where South Carolina is. It's in the darkest section. South Carolina's multiplier is actually 2.41. So for every dollar the state of South Carolina spends, the federal government spends $2.41 in our state. Okay. So this is kind of how the Medicaid program is redistributing income from high-income states to lower-income states like South Carolina. Okay. All program states are determining the type, amount, duration, and scope of services. So the federal government sets a minimum of what they must provide for individuals and the minimum income levels, but states can do above and beyond that and often do. Eligibility for Medicaid is determined by two things, income and family structure. Okay, so this is where the federal poverty line is going to enter again. Okay, so here are some kind of national level statistics on who's eligible for Medicaid. And if you notice, the date here is important, January 2013. So this is before some significant changes in the Medicaid program take effect. Okay, so children, if you look at the median state, or the state kind of right in the middle of the distribution, the median state covers children up to 235% of the federal poverty line. So remember, a family of four is 23,850. So, 50,000 or so. So all kids and families that earn less than $50,000 would be covered by Medicaid. Pregnant women are also a group that's covered a lot by Medicaid. These are both federally mandated groups that are covered. But you can see who's not covered so much under Medicaid. We've got working parents, jobless parents, and then over on the right-hand side, childless adults. Okay. This childless adults is where a lot of the uninsured population are, and under the Affordable Care Act passed in 2009, it was proposed that all states cover all of these three categories on the right up to 138% of the federal poverty line. It would raise that bar up to where that line is for all people in the state, whether they were children, pregnant women, or just single adults with no kids. Okay. As some of you might know, the Supreme Court overturned that part of the Affordable Care Act and made it optional for states to cover those individuals. So here's a map of which states have opted to cover those individuals up to 138% of the poverty line and which states have not. Okay? So the orange ones are those that have not chosen to. Now the reason why the Supreme Court overturned it was they said it was an unfunded mandate. The federal government had passed something and hadn't paid for it. Okay? The deal was the federal government was going to pay fully for the program to cover everyone for 3 years and then down to 90% by 2020. But still at some point it would be have to shared, at least in part, by state governments. So a lot of states have opted not to do it. Okay. This slide was relevant 10 hours ago. Okay. After the recent federal court decision that has overturned the marketplace subsidies in states that don't have their own marketplace, this is not so relevant. But for a lot of people in states that did not pass the increase in Medicaid, the other problem was they also weren't eligible for subsidies. So first of all, they're kind of at a disadvantage because their state didn't adopt the expansion, so they can't get Medicaid. The second problem is they can't get the subsidies from the government to buy health insurance on their own because you can only get a subsidy if you have 100% of the federal poverty line or above. So it's called this coverage gap. It's estimated in South Carolina people would fall in this gap. Around 200,000 people would fall in this gap. But since we don't know the status of those subsidies, I'll just skip over that. Okay, so let's talk about why Medicaid is important for poverty, right? Think about it. Medicaid is a form of health insurance. Why do you get health insurance? Is it to be healthy? No, it's to insure yourself against the financial risk involved if you get really sick. right? And so what we should be talking about here is how does having this form of health insurance, how does having Medicaid get you out of those circumstances of being at risk for paying those huge medical bills? Okay, so this first bunch of research here by Amy Finkelstein, the economics department actually brought Amy Finkelstein to campus last year to talk about her research. Maybe some of you were at that session. Amy Finkelstein actually worked with the Oregon Health Experiment. In Oregon, they decided to expand their Medicaid program, and they had X number of slots, and they had a lottery. They said, if you want one of those Medicaid slots, apply to our program. And so they got a bunch of applications, they assigned those slots by lottery, and then they followed the people that won the lottery and the people that didn't win the lottery to see how they did, right? To see what the effect of Medicaid was. They found that those people that got Medicaid had higher health care utilization, better reported health, and here, what's important for our discussion here is lower out-of-pocket medical costs. On average, people decreased their out-of-pocket medical costs by $800. Remember, we're working with a population here that's earning around $20,000 a year. $800 in decreased out-of-pocket medical spending is a significant amount. This other paper, I won't get into the details, finds an effect as well, that it's decreasing the poverty rate. So Medicaid does seem to have this income security component, right? This component that is keeping people above the poverty line. The last thing I want to talk about quickly is the minimum wage. Okay, federal minimum wage is $7.25. Okay, so what would a person earning the minimum wage earn in a year? Take $7.25, multiply it by 40 hours a week, multiply it by 52 weeks a year, and you get $15,080. Okay, so if we're thinking about, okay, the other thing to note about the federal minimum wage, it doesn't change year to year. Prices change year to year, but the minimum wage doesn't. So $15,000 this year was the same as $15,000 4 years ago, even though prices have gone up. So what this does is it looks at, okay, here's the federal minimum wage in a given year. How does that compare to the poverty line? And so the little dashed lines are different poverty lines. We know there's different poverty lines depending on your family composition. So the one that's kind of in the middle there is one adult, one child. And you can see currently that $15,080 that's in bold is below the poverty line for one adult and one child. Okay? And you can see over history how that compares. The only time when it was above the poverty line for that single adult with one child was back in the 60s. Okay? So here's what we're talking about is, can you live on this wage? How does a family with one adult working at the minimum wage, they're inevitably going to be below the federal poverty line. And again, remember the minimum wage isn't changing based on where you live. So here's just a cost difference. Blue states are below national average in terms of prices. Green states are above the national average in terms of prices. So if you're earning the minimum wage out there in California, that's a lot different from earning the minimum wage here in South Carolina. So even if you hear about the problems in South Carolina earning the minimum wage, think about that worker then as well in another state that has really high prices as well. Okay? The problem significantly worsens. Okay? As a result, many states have adopted their own state minimum wage. Okay? So the green states are states with minimum wages higher than the federal, so above $7.25. Currently, the highest is in Washington at $9.32. Connecticut has passed a bill where their minimum wage is going to go up to $10.10 by 2017. And even localities have adopted their own minimum wage. Seattle currently has the highest proposal, at least, or that's been passed, to increase it by $15 to $15 by 2021. Okay? Representative Gilda Cobb-Hunter has proposed legislation in the state of South Carolina to raise the state minimum wage here to $10. Okay. Running out of time, so just a quick look at who is in this minimum wage group. This is the percent of hourly workers that are paid at or below the minimum wage. I don't have time to go into detail here, but a lot of people are paid below the minimum wage as well. Okay? So a lot of these people are young, not surprising. A lot of these people are part-time workers, also not surprising. And a lot of these people have less than a high school degree, also not surprising. Okay. In terms of the industry they're working, you see that huge pie piece? 46.7% in food preparation and serving. Okay? So if you think about the industries that have an interest when the minimum wage is talked about being raised or lower, that's the industry you're going to be on the lookout for. Here's a really interesting slide that looks at who earns the minimum wage in terms of their household income. So on the left-hand side, we have household income as a fraction of the federal poverty line. So that first row there is less than 1. So those families, less than 1 is, they're earning less than the federal poverty line. The last row, greater than 3, means that those families are earning 3 times the poverty line, okay? So over $60,000 a year. And then I want you to look at the right-hand most column, the percentage of workers with wages below $7.25 an hour. Okay? Of those workers that are earning at or below the minimum wage, where are the greatest percentage of those individuals? They're in families. 44.6% of them are in families that are earning more than $60,000 a year. Okay? Of those that are earning the minimum wage, 12.7% of them are in families that are living below the poverty line. Okay? So it's interesting to think about this, because when we think about changing the minimum wage, we want to think about the distributional impact, right? And what this data is telling us is the distributional impact. A large percent of the benefits of increasing the federal minimum wage will go to families that are earning over $60,000 in household income. That's not to say it's not helping those that are below the poverty level, but a really high percentage are going to high-income families. This was actually researched relatively recently by the CBO. Obama had a proposal to increase the minimum wage to $10.10. So the CBO evaluates that and determines what the costs and benefits are of that. What they found in their report is that increasing the minimum wage to $10.10, this is a federal increase, would increase income, okay, because you're raising the minimum wage. It's increasing earnings by $31 billion. Okay, that $31 billion, 19% would go to families below the federal poverty line, 29% would go to families earning more than 3 times the federal poverty line. Okay, so that's where the distribution is interesting. Increasing the minimum wage would also have negative labor supply effects. Okay, if you increase this price floor, if you increase the price that businesses have to pay, what might they do? They might say, instead of hiring 2 workers, I'm just going to hire 1. Okay, and so you expect there to be this decrease in jobs, and they estimate that jobs might decrease by $500,000. Okay, so when you're evaluating all these changes to the programs, it's really important to keep track of these positive and negative effects. And when you look at kind of the net effect, the CBO, the Congressional Budget Office, says that overall real income would rise by $2 billion. Okay, compare that to our GDP of $17 trillion, and it doesn't seem like too much. And it would move about 900,000 people above the poverty threshold, which, given those numbers, isn't, an insignificant amount, but maybe not as much as you might have previously thought. Okay, so I've given you a lot of information, a lot of empirics. Hopefully it's just been a way to start thinking about this population of the working poor, who they are, where they live, and how the government helps them. By talking briefly about these 3 federal programs, I hope you understand and appreciate the complexities and challenges our legislators have, right, in designing these type of policy programs to help this population. And I'm sure more insight on this will come from the second half of our session this evening. So thank you so much for having me. Enjoy the rest of the month.
Really terrific information there, Dr. Hennessy. Appreciate that very much, and very illuminating facts, putting a face on what poverty really is. And if I could just add to that, one of the reasons where I got interested in this topic about 5 years ago when I was working in public television was I was doing a series on the working poor in South Carolina, who they were, what they were facing. And I ran into a woman, a single mom who was living in Richland County, where I'm from, in Columbia. I said, what are you up against every 2 weeks here? You're obviously out there working. She had a minimum wage job at an unnamed fast food restaurant. She goes, I would just tell you how difficult it is for me. I'm a single mom. My paycheck, she gets paid twice a month, on the 1st and the 15th. Those paychecks that she got on the 1st and 15th were $385. $385. Can you imagine on the 1st, it's time to what? Come up with rent, maybe some transportation if you have that. Public transportation in the state has been cut back. What about childcare? How do you provide childcare for somebody that age, knowing that the average cost per month is about $400? And And that's at a very well-run child daycare center. That's what inspired me really to sort of find a way to put a face on this topic, because it is difficult to grasp. It is difficult to figure out how do we lift these people up without penalizing the people who are doing well. Again, I said we had many vigorous disagreements in society about how to best approach the issue of poverty. We're going to talk about that coming up after the break.